Abductor lesions are a leading cause of lateral thigh pain, especially in middle-aged and older women. These injuries often involve the gluteus medius and minimus muscles, which play a crucial role in stabilizing the hip during walking and standing. As people age, the risk of developing abductor tendon problems increases, with a significant rise in prevalence after the age of 70. Many patients experience persistent pain on the outside of the hip, which can be aggravated by lying on the affected side, walking, or climbing stairs. While conditions like trochanteric bursitis were once thought to be the main culprits, advanced imaging has revealed that abductor tendon lesions are often the true source of discomfort. Understanding the anatomy and function of these muscles is essential for accurate diagnosis and effective treatment. Diagnosing hip abductor lesions requires a thorough clinical examination and the use of advanced imaging techniques. Patients typically present with lateral thigh pain and may have a limp or a positive Trendelenburg sign, indicating muscle weakness. Tests like the hip lag sign and the 30-second single leg stance are helpful in identifying abductor insufficiency. Magnetic resonance imaging, MRI, is considered the gold standard for assessing tendon tears and muscle fatty infiltration, which can predict the outcome of surgical repair. Standard hip and pelvic X-rays are also important for initial evaluation, especially to detect bone changes or prosthetic issues. Ultrasound can be useful, particularly when MRI is not available, but it is more dependent on the operator's skill. Accurate diagnosis is key to guiding treatment and improving patient outcomes. Treatment for hip abductor lesions usually begins with conservative measures. These include nonsteroidal anti-inflammatory medications, physical therapy, activity modification, and sometimes corticosteroid injections. In some cases, plasma-rich protein injections or radial shockwave therapy may be considered. If symptoms persist after several months, surgical intervention may be necessary, especially for complete or partial tendon tears that do not respond to conservative care. Surgical options range from direct tendon repair using sutures or anchors to more complex procedures like muscle transfers or graft augmentation for chronic irreparable tears. The choice of treatment depends on factors such as the extent of muscle fatty infiltration, neurologic integrity, and the presence of prosthetic hips. Ultimately, the goal is to relieve pain, restore function, and improve quality of life for patients. When surgery is required for hip abductor lesions, several techniques are available. Direct repair can be performed using either open or endoscopic approaches, with sutures or suture anchors securing the tendon to the bone. For chronic or irreparable tears, augmentation with synthetic grafts or allografts may be necessary. In cases of significant muscle atrophy or fatty infiltration, muscle transfer procedures such as gluteus maximus or vastus lateralis transfer are considered salvage options. Studies show that both open and endoscopic repairs can improve pain and function, but open techniques may have a higher complication rate. The degree of muscle fatty infiltration is a key predictor of surgical success. Postoperative rehabilitation is crucial, with restricted weight-bearing and gradual return to activity. Ongoing research aims to refine these techniques and improve long-term outcomes for patients. In summary, hip abductor lesions are a common and often under-recognized cause of lateral thigh pain, particularly in older women. Accurate diagnosis relies on a combination of clinical assessment and advanced imaging, with MRI playing a central role. While most cases can be managed conservatively, surgery is reserved for those with persistent symptoms or significant tendon damage. Choice of surgical technique depends on the chronicity of the lesion, muscle quality, and patient-specific factors. Despite advances in understanding and treating these injuries, more high-quality research is needed to determine the best management strategies. As our knowledge grows, patients can look forward to more effective treatments and improved quality of life.